On November 6th, voters will decide if working Idahoans should have access to health care coverage through an expanded Medicaid program. An estimated 62,000 Idahoans are currently in what is called the insurance coverage gap, meaning they make too much money to qualify for Medicaid or not enough to receive assistance in purchasing affordable health care coverage on the Idaho Insurance Exchange. Most of these 62,000 Idahoans are in jobs we interact with every day. They are construction and seasonal workers. They take care of our children or serve us in restaurants. They cut our hair and work up and down Main Street. In the last few years, a number of proposals were discussed by the Idaho legislature that would have partially addressed the needs of some uninsured Idahoans, but those efforts proved to be unsuccessful for a number of reasons. One was cost. Some legislators were reluctant to spend state dollars on a partial solution when the same amount of money could have been used to match hundreds of millions in federal dollars and bring those tax dollars back to Idaho to provide comprehensive coverage to low-income Idahoans. Other legislators were philosophically opposed to using federal dollars to help pay for health care in Idaho. With the legislature at a standstill, a citizens' grassroots effort sprouted around the state. Signatures were gathered on petitions supporting a ballot initiative to try to break the logjam and finally address the issue of the uninsured in Idaho. Nearly 75,000 registered voters in Idaho, across the political spectrum, signed petitions, and in July, the Secretary of State certified that the question of Medicaid expansion would go to the voters on the November ballot as Proposition 2. Passing a ballot measure in Idaho has the same effect as the legislature passing a bill and the governor signing it into law. Upon passage in November, Proposition 2 would become Idaho law. Voters will see the entire statutory language on the ballot directing the Department of Health and Welfare to expand Medicaid to low-income Idahoans. They will also see a short ballot title that captures the essence of what nearly two-thirds of Idahoans have consistently supported in public opinion polls over the last 4 years. The short title lets voters know that Proposition 2 is an initiative to provide that the state shall amend its state plan to expand Medicaid eligibility to certain persons. If Idaho voters say yes to Prop 2, Idaho would become the 34th state to expand Medicaid to hardworking low-income residents trying to lift themselves out of poverty. Beginning in 2020, each of those states will be required to come up with 10% of the cost to provide health care coverage to their Medicaid expansion population, but the remaining 90% of the cost will return to their states from federal taxes that they've already paid. If Idahoans say yes to Prop 2, here's what the cost will be to the state over the next 10 years, a total of about $530 million. But the return on that investment would be $4.6 billion infused back into Idaho's economy. The Idaho Hospital Association commissioned an independent study on the impacts of that $4.6 billion to our economy, which shows a significant benefit to Idaho in terms of job creation, consumer spending, and additional tax revenue to the state. While there are 62,000 uninsured Idahoans in the gap, that doesn't mean they aren't currently receiving health care services. Without health care coverage, they may have gone without something as simple as an inhaler for asthma or insulin for diabetes, and yet they show up in the emergency room when their health reaches a crisis point at a significant increase in cost. These examples and countless others resulted in your community hospitals providing $272 million worth of uncompensated care, either through charity care or bad debt. But that financial loss is offset by higher premiums and a higher cost for insured patients who access health care services. The fact is, Idahoans are paying for the uninsured in a variety of ways. We send our federal taxes back to Washington, D.C., which other states have elected to use to provide health care coverage to low-income workers. Not a single rebate check or refund has come back to any Idaho taxpayer because our state has not yet expanded Medicaid. Instead, Idaho has indigent programs that cover health care costs for just a fraction of our uninsured population. They're paid for by higher property taxes at the county level and income tax at the state level. In 2017, those indigent programs assisted 4,200 Idahoans. If Proposition 2 passes in November, Idaho could provide comprehensive health care coverage to 62,000 workers for nearly the same cost to the state as the indigent programs. If Idahoans say yes to Prop 2, it could also mean lower premiums for Idahoans with commercial insurance. A recent Kaiser Foundation study indicated that commercial premiums are, on average, 7% lower in Medicaid expansion states than non-expansion states like Idaho. If Idahoans say yes to Prop 2, it will give more Idahoans access to necessary health care services and help maintain access to those services in many of our rural Idaho communities. Of the 27 rural critical access hospitals in Idaho, 19 operate at zero margin or less, meaning if they didn't receive additional property tax support from the county or hospital district, or if a philanthropic foundation didn't assist them, they could face closure because of the staggering amount of uncompensated care even a rural or frontier hospital must provide to uninsured patients. So what changes if Idahoans say yes to Medicaid expansion? Instead of the current practice of uninsured Idahoans receiving care in the most dire circumstances and those costs getting shifted to the rest of Idaho taxpayers, Medicaid expansion would provide comprehensive coverage for 62,000 Idahoans, with the state responsible for just 10% of the cost. Simply put, for every dime that Idaho comes up with, the federal government will return $1 of our money to pay for health care for working Idahoans. Rather than no reimbursement for the uninsured, Idaho can turn that dime into $1 and provide preventive health care and lessen the demand for more expensive care. By voting yes to Proposition 2, Idahoans will be saying yes to better health, yes to a stronger economy, and yes to Idaho families. Your vote matters. Please remember to vote on November 6th.